Did you know that we have been using MRI for more than a quarter of a century? Hi, I'm Natalie Henning, the host of the show Ins and Outs of Medical Imaging. This is a production of Creative Communications at Jordan High School in Jordan, Minnesota. I'll be talking about the background, why, how, and when MRIs might be needed. First, let's start with what MRI stands for. It stands for Magnetic Resonance Imaging. According to New York Times, in 1977, before the first MRI machine was created, the NMR was invented, which helped Raymond Median create the invention of MRI. Let's get into what MRI is. Mayo Clinic, a website that provides medical care, research, and education, says the MRI uses magnets and radio-generated waves that create images and 3D images for doctors to look at and find out what the issue is. MRIs can get images of all over the body: the brain, the heart, the internal organs, and even the bones. Now I'm going to be talking about when and why doctors would use MRI to get images of a body. Most commonly, doctors use MRI to test the brain and the spinal cord to test for aneurysm, stroke, tumors, and brain damage. Through MRI, infection can be found. It can also diagnose arthritis in the joints. It can also be used to help find the right spot to get a biopsy from. I'm going to be explaining different kinds of MRI and when they might need to be used. Cardiac MRI is used to look at the blood vessels, the blood flow, and the function of the heart. It can even help diagnose different conditions going on, including tissue and muscle damage from heart failure or heart attacks and the outcome of surgery. This information is found on heart.org, a website that specializes in helping people try to live a healthier lifestyle. Now I'm going to get into more types of MRI that might be used depending on the situation. There's epilepsy protocol MRI that is used to look at the brain, the neck, and the spinal cord. There's functional MRI that is used to look at the brain and other body parts. There's also screening breast or breast MRI, which is used to examine abnormalities or breast cancer. Now let's get into the overall impact of MRI in the medical field. Over time, MRI has been one of the most used ways to examine a body through images. Being able to see inside a body has saved many people's lives. Also, now because of MRI, we are able to tell how age impacts disease. We're also now starting to see smaller MRI machines that are able to be placed in doctors' offices, and they're also transportable between the offices. This information is from the University of Illinois, which studies the history of healthcare. Now I'm going to be talking about what to expect when you're getting an MRI. When getting an MRI done, you'll lay on a table that will move into a tube-shaped machine. You have to lay very still so the images are clear. Depending on the facility you're at, you might get earplugs or headphones that play your choice of music. There's a chance you might need an MRI with contrast, which shows doctors your veins and artery by making them more visible. This will happen by contrast either being injected into your IV or a prescription given to you by your doctor. Please follow along in the next episode if you are interested in the medical field or are trying to make a career out of the medical field. Please like, follow, and share on YouTube at JHS Creative Communications.